Welcome to my channel. Today we will discuss nitrofurantoin, which is a commonly prescribed antibiotic, and it's used mainly for treating the urinary tract infection, also known as UTI. And the generic name is nitrofurantoin, and the brand name it comes in US is Macrobid and Macrodentin. And this is actually it's an antibiotic which is mainly used to treat UTIs, and it works by killing bacteria in the urinary tract or prevents its growth. And in this video, we will talk about how nitrofurantoin is used, how it works, common side effects, serious side effects, and that require medical attention, and important situations when this medication should be avoided. And I selected this topic, this medication, because I have seen lots of prescriptions which are actually for nitrofurantoin to treat urinary tract infection. So, this medication is actually indicated for uncomplicated bladder infection, which is also called acute cystitis. And it works by killing bacteria or actually prevents the growth of bacteria. And it prevents the recurrent urinary tract infection in some patients, so it's used for prevention. And this is very important to note that it's not usually used for kidney infections, which is called pyelonephritis, because it does not reach that concentration in the kidneys which can treat the kidney infection. And the important counseling points about this antibiotic is that, which I usually talk to my patients, they take exactly what is prescribed as prescribed by your doctor, and how to take it, and if it's twice a day, morning and evening, 10 to 12 hours apart, or whatever doctor asks you to take, like how to take it. And the second thing is that take with food or milk to improve absorption and reduce stomach upset. And another important thing is that even if you feel better, just finish the course. Sometimes when you stop it too early, then infection might come back, and it can also lead to antibiotic resistance. And drink plenty of fluids unless your healthcare provider has advised you otherwise. So, and another, some people they ask me, okay, what should I do if I forgot to take the dose? So, if you miss a dose, then you can take it as soon as you remember. But if it's too close to the time when it's due for the next dose, then skip that dose and take the dose at the regular time. So, the most common side effects, which are actually because of this medication, which I have seen, is nausea, vomiting. Some people they complain that it causes stomach upset, and they loss of appetite. They are not hungry after taking that medication. They don't want to eat, and some people they have headache, or some may experience dizziness. So, the question is that when to seek medical advice while on this medication. So, these side effects, which I am going to mention, they are rare, but if anyone sees those side effects, such as persistent cough, which is not going away, if there is any pain in the chest, or shortness of breath, any fever, or some people, if they have yellow skin or eyes, dark urine, or if they see like if they have any pain in the right, like upper right abdominal pain, or severe nausea, or some people if they have any burning pain or any weakness in the hands, feet, or tingling sensation, so, or rash, hives, swelling of the face, any of these serious side effects, then they need to seek medical advice. So the contraindications of using that medication, if someone is allergic to, which is a true allergic reaction, if someone has hives and difficulty breathing or any other allergic reaction to nitrofurantoin, or if someone has severe kidney impairment, like kidney dysfunction, or like if the kidney is the function is compromised, or the third thing is that another contraindication, that if there is any previous liver damage which is caused by nitrofurantoin. And it's not recommended for the infants who are younger than 1 month, And in the pregnant woman, if it's near term pregnancy, means they are 38 to 42 weeks pregnant. So, the most common drug interactions I would like to indicate, one of the most common is with magnesium containing antacids. So, if someone is taking any over the counter medications like which has magnesium in it, like magnesium supplements or vitamins and minerals which has magnesium in it, or antacids which are used for acid reflux and they have magnesium in it, these two should not be taken together, otherwise it can decrease the absorption of this antibiotic and you will not get the most out of it. And the second common interaction is propanicid, and the third one is sulfenpyrazone, although there are lots of other drug interactions, but these are the most common drug interactions. So the point is that it's very important to tell doctor about all the prescription and over-the-counter medications, since these over-the-counter medications, they are some of them they need to be spaced out with your regular medication to avoid any drug interaction. So the main, actually the counseling points which I would like to emphasize is that take with food. It's very important because some people, patients, they have nausea, and some may have stomach upset and vomiting. It is usually, it's actually it happens when you start the medication, and it often improves as your body adjusts. So, and the vigorous exercise or lying down immediately after taking the medication may worsen the symptoms. And headaches, some report headaches. So, it's very important, like keep yourself well hydrated, unless your doctor told you something else, or limiting your fluid intake in certain medical conditions. Or if you are dizzy, again, hydration is very important. It's very important to contact your doctor if the symptoms they worsen, and if you don't feel improvement within 2 to 3 days, then in that case that doctors will might change the antibiotic, or they will decide that what's going to be the next step. And it's another important point which I would like to emphasize in my counseling, that it treats the bladder infections. It does not treat the kidney infection. If the infection has gone into the kidneys, then that antibiotic and in that case, doctors might suggest the alternative to treat the kidney infection. So, in this, all this information which I am providing in this video is for educational purposes only, and it's not a substitute for the medical advice. So, friends and family, if you like my effort and if you like this information, please make sure to subscribe, like, and share with your friends and family. And it's an encouragement for me to keep on sharing many new and interesting videos and more informative videos. So I hope you like my effort. So see you soon then. Stay blessed, be happy and healthy, and till then, bye.